That's okay. Yes. We'll see if anybody jumps on in. This one, I don't think expect as many people. This should
Okay.
shoot out.
Okay.
Because this is the one I promoted a lot. So
On here,
live.
yeah, yeah. And I had a few reach out yesterday, Messenger, asking for the link, and I sent them the copy of the link.
Perfect. All right, guys. Hey, this is Coach Bricks and Dr. Joe. We're just waiting a couple minutes to see who's going to come in from the waiting room and stuff like that. So as soon as we wait another minute or two, we got about a minute. We're going to rock and roll here with our discussion on reactive and proactive care. Everybody who's in right now, we greatly appreciate you guys.
Absolutely.
Honestly, I think it's awesome that you guys have taken the time out of your day to come in and join us on this Saturday morning here. So we're excited. See our nice background, Dr. Joe Water here. Guy goes high tech on me, man. I'm just simple with a brick wall, you know what I mean? I'm good with that. I don't need anything crazy. Joe goes with this nice little RX. Look at that thing. Look at that. Guy going all out.
Absolutely.
Yeah,
hey.
I like it. I like it. So just another minute here too, guys. And we are going to get ready to rock and roll. All right, everything looks good on that end. Good chat's open. Let me just move this over, guys. Have rock here. All right. Let me just check the other one, guys. Are we ready to go in a second?
Yeah. And it's up to you if you're able to hit like a thing that tells you to add on again, or if we don't need to.
All right, guys, we're are ready to rock and roll. Hey, first of all, thank you so much for everybody joining in here. We got actually Facebook also as well on Coach Joe's, or Dr. Joe, I should say, his Facebook page. And we're also here live on our webinar. So you guys, we discussed this, okay, a long time ago. All right. Dr. Joe and I have known each other for about 20-some years. He was one of my first athletes I've ever got the opportunity to train. He played at the University of Maryland, actually has a national title under his belt, playing basketball down there. And then we hooked up afterwards.
Absolutely.
You know what I mean? You finished up, you went to exercise, you became an exercise physiologist. And then you said, hey, Dave, if I ever get to this point and we're at a certain point, we got to hook up. And that was like 15 years ago.
Absolutely.
You know what I mean? So we've been at this for about 15 years. You finished up, you became a doctor, one of the best in the area. I refer every single person to you because you take the time and actually care for the person. You actually listen to them and take their advice in as well as what you know and guide them in the right direction, which I think is important. And I also think there's so many other things that go on. But we came up with this idea, you know what I mean, and really started diving in about 2.5 years ago.
Absolutely.
You know, and we said the model's broken. And we've talked about this, and I think the majority of people in this country would admit the model's broken. When I talk to people, they say the model's broken. The healthcare system model's broken. So we said, what can we do? Okay. I'm not a doctor. I don't plan on ever being a doctor. This is the doctor. Like I said, he's the man. And like I said, I refer everybody to this guy, and I go to him. So we talked about proactive and reactive. And I think this is where we're at in this country, is that most people have reactive issues. You know what I mean? Proactive. Why did RX Health and Fitness come about? And it was based on those two things. You know what I mean? They were the things that we really wanted to focus on. How can we get people to be healthier, happier, and all that other kind of stuff? So why don't you break down what reactive care is and then proactive care?
Perfect. Reactive care versus proactive care in terms of what I see in my definition there, Dave, and those online, from a proactive, or let me start first from a reactive standpoint. As Dave was saying, majority of what we see, especially for a person in terms of their own care or what they're complaining about or what the concerns are from what they're receiving from a healthcare standpoint or an authorization or a treatment standpoint, okay? Reactive care, in my mindset, is waiting for something to come to you, or waiting for something to occur. We react. Somebody startles you, you react, hands up, okay? The same thing with our care. We're posed with a health situation, and then all of a sudden we have to react, okay? Our knees are starting to kill us now, or what now? My back, my neck, shortness of breath, chest pain, okay? What do I do now? from a reactive care standpoint. That is exactly the opposite of what I try to promote as a preventative care specialist or person in terms of proactive. But again, that reactive, almost waiting for something to happen, which usually 90% of the time is nothing good. Nothing comes to you in your lap 90% of the time that is good, unfortunately there, Dave. But when it comes to our health, from a reactive standpoint, where, hey, people are trying to get coverage for surgeries and authorizations and insurance premiums and cost and those things going up, that's from a reactive standpoint that most of us have been boxed into, and that's unfortunate. Now many are starting to want to think outside of the box, and that's what leads towards that, Dave, that proactive care. I say proactive care, guess what? You become a pro, you take ownership, okay? I'm going to own this. I'm not going to pay more, okay? I'm not going to take more, okay? I want to find out an alternative, okay? I want to live healthier, okay? Not only healthier, I want to have more energy, okay? The proactive, okay? Then how do I take ownership over my health situation, my care, my lifestyle? How do I take ownership over the cost? Okay, I'm not going to pay these things. How do we talk about and how do we go about the proactive before? Reactive, we're reacting after the fact. Again, a situation comes to you, naturally, guess what? In our own instinct to remain alive, we react, okay? Proactive, what do we do before the fact, okay? So we're going to go into more. RX Health and Fitness came about more from a provider standpoint, working with those who are qualified. Dave himself is an exercise physiologist. We have another young man that has joined us, Noah Kane, and myself as the third exercise physiologist there, teaching people about the body after we evaluate, give them their pros, cons, where their goals are, and then safely guiding them. But that's allowing them to take ownership of their life, their lifestyle, their health, their care. And guess what? At the bottom line, the cost, okay? I much rather, everything costs. I much rather pay this way. What we said once before in one of our other podcasts, pay now or pay later. Pay now is proactive, pay later is reactive. I can tell you the cost are more than 2 to 3 times the rate on the reactive side, okay, as opposed to the proactive side.
And I think you brought up a great point there. And I think people don't always see it because they don't think that they're ever going to have to pay at some point. Everybody thinks, hey, we're going to go through life, we're eventually going to die, and I'm never going to have any problems. But we know that's not the case in 95% of the people that are out there, 95% of the people. Very few people just die, never have any kind of comorbidity or any problems, never have any surgeries, nothing. Most people have something. So if we can get ahead of this, if you can get ahead of this, it's such a benefit. Yes, you have to pay for it, but it's such a benefit in the long run, especially with the way healthcare has gone and the way insurance has gone. I was in physical therapy 25 years ago. What they covered back then compared to what they cover now is totally different. And you see that. I mean, you've been in it as a doctor. You see what they used to pay and now what they don't. So why don't you break that down a little bit, the insurance type thing? I know you're not completely into the insurance field. I know you have other people who do that, but at least you've seen the change in how much people have to now pay out of pocket, even for co-pays and things like that. When I was in therapy, we very rarely had a person ever pay a copay, ever. So what's the difference there?
Absolutely. So within the healthcare system structure, okay, yes, you have those who are providers, okay, so that entails those like myself that have gone into, in terms of we're physical therapists, or guess what? Physiologists should be in that umbrella of a provider, okay? Those who have gone into the system to provide care, okay? So those are the workers working with the person directly, okay? Then you have a component of government regulations, okay? So you have some, even, this is not even privatized insurance or private, okay? But from a federal government standpoint, you have those things we call Medicare, okay? So you have Medicare benefits or coverage that are meant from that regulatory standpoint. Then you have some that meet a qualification for state-based care, which is Medicaid. Okay, so I often encourage or educate a person the difference between a Medicaid or Medicare, and there are different components that regulate there, okay? Then instill in that insurance, or it's not in that regulatory, there's a kind of a third tier that privatized, okay, in terms of the coverage, okay, for these resources that Medicaid or Medicare doesn't cover and doesn't leave a person bankrupt to face the medical costs themselves. You have insurers, okay? Private, okay, where there's less regulation, okay, less government control. I always leave my politics out of it. I hope there becomes more regulation and control, okay, because that's what we're seeing the problem now. You have many, believe it or not, Dave, doctors, specialists, providers upset about the continuous increase in costs that is causing the person to make different decisions, the patient, okay? Okay, so with all of this, you have the patient in the middle, you have those three factors we were just mentioning. You have the patient in the middle that has to navigate those increased costs, okay? The reduction in the benefit. So a person's paying a premium. The premiums keep going up year by year by year, higher than the standard quality of life increase, okay? That's the mismatch. So a person is left with less choices there, okay? But privatized insurance decides, hey, what they're going to cover for your care more on a reactive standpoint, okay? And that's where I feel part of the problem is. Now, where I'm hoping to change and what you're starting to see from a regulation standpoint, government, I was looking at an article earlier this week, hoping, you know, we're in 2026 now, but hoping by 2020, 2030, okay, 4 years, but in the meantime, what do we do? By 2030, shifting where insurance recognizes, whether Medicare and private recognizes an element that they call value-based care, okay? Where the value is based is where the coverage, reimbursements, authorizations, and cost will be gear focused. Right now, the value, unfortunately, is based reactive, okay? Not based on how healthy a person is, but I'm not sure if many have noticed whether it's been through their employer or someone is sent out to the house under your insurance plan and they want to get a baseline physical or want to get some baseline blood work to give you a $50 gift card to let you know how healthy you are, okay? But what that is doing is letting them know how healthy you are, how much of a cost you are to them. So when they see on a person's health list, obesity, hypertension, I see you've been seen for high cholesterol, pre-diabetes, heart disease, okay, arthritis, you had this surgery, so lumbar degenerative arthritis of the lower back, okay, autoimmune conditions, okay, when they see this list of subsets of what we call comorbidities or health disparities with the person there, that raises their risk level to an insurance, okay, to an insurance company, what they're looking at. So they're looking at, oh my goodness, I always say Joe Schmo. Yes, I'm named Joe, but they're looking at Joe Schmo over here. Wow, he's a cost to the healthcare system at, 20, 30 comorbidities that are increasing, okay? And his cost is over the course of a year, 20,000, okay? As opposed to person A or person B, okay, Joe Schmo B, that actually, okay, is doing more. They don't have obesity. They don't have hypertension listed on their health history, okay? They may just have something they're watching, cholesterol, but they're less of a risk. And then actually they're starting to transition, hopefully, to valuing more of that style, okay? So RX Health and Fitness came about actually before now these changes that we'll hopefully start to see over these next few years, where guess what, a person will be able to hopefully have a benefit that or a coverage that encourages, guess what, them to be healthy on the proactive end, okay? Where hopefully we see that a person may be spending $1,000 or $2,000 up front on their health to prevent all those other things, hopefully saves that other $20,000 during the course of a year that they don't have to go ahead and spend or utilize, and they feel better. Okay, they're happier, longevity, okay, all of these things there.
Yeah, I think you nailed it. I think that's one of the biggest things that I see is that we're not proactive enough. You know what I mean? People wait until something happens.
Reactive.
Correct. And if we actually just took time, and it doesn't have to be like a killer workout. Everybody thinks, oh, I hate going to the gym because I might get sore. That's not the whole basis of it. It's about movement.
Absolutely.
We don't move enough in this country. We don't move enough period.
Mhm.
And then we don't do a lot of other things. A lot of people know what's correct,
Uh-huh.
but they need a guideline of how to do it. And that's why RX Health and Fitness came about, because we wanted to give them that guideline.
Yes,
We wanted to see where you were baseline.
absolutely.
Okay. Whether it's through blood work, all the assessments that we do, the evaluations that we do, so we can help you get ahead of it.
Absolutely.
We want you to live. I want you to live. Dr. Joe wants you to live 120, where you're disease and pain free.
Mhm.
You know what I mean? That's what we were meant to do on this earth. And that's why we really, really are trying to push this whole proactive approach to everything,
Uh-huh.
because too much is reactive. Everything is based on that. And the insurances know that, and they continue to drive the prices up. Everybody will complain about, hey, my insurance cost goes up, my insurance premiums go up. There's a reason for that.
Mhm.
If we took better care of our health, think about this, right?
Mhm.
And nobody went to the doctors or just for your regular physical.
Yeah.
What could you do? You would drive the cost down immediately.
Yeah.
And I understand, and I know everybody is different, okay? But there are so many things that you can get ahead of.
Price
that's what it
goes
is.
with demand.
Correct.
Yeah. If we demand less on this end, the price will have to, okay? If we demand more on this end, the coverage will have to,
Yeah.
okay? If a person is posing their insurance, okay, you know what? Why won't you cover $50 a month for me to be active in a gym, okay? Or be able to utilize I'm looking into healthy supplements or something for myself. Or, hey, why won't you cover for me to sit with a nutritionist, okay? Where a person is saying, look, I'm looking for a plan that is more about me proactive. If insurance companies see the demand change, guess what? They're all about the money in business. They'll have to go where the business and the money is, okay? Many posing themselves this year, start of 2026. I've even come to the practice. Dr. Thomas, is it worth it for me to have insurance this year? I'm really thinking I keep that $10,000 this year that I'll be putting into a premium, okay? Just in case if something happens, okay? What can I do to do my best outside of the inevitable emergencies to be more proactive? Hey, I want to go with a premium that's about $2,000 a year, which is still like over the last few years, that's still quite high, but we're at a point where 2,000 is like great nowadays. And then putting those resources or that $8,000 into myself, or if I'm not utilizing it, into an account where I can, guess what, enjoy my hard work, okay? Absolutely. Many are starting to ask, and I agree. That's more on the proactive.
Correct.
I know for myself personally, Dave, the same thing. I want to receive less, or when I say I want to have to not be a victim of the system and just pay just to pay, okay? I'd rather do more, okay? So many ask, what do you do, Dr. Thomas? I say, hey, I do exercise, okay? I do try to keep an eye on my sleep, okay? My mental health, okay? Trying to be as proactive. Outside of an 80-hour work week, and yeah, family, kids, sports, those things, I understand. We all have these things, but how much are we able to be proactive on our end from the beginning there?
You know, that's great that you said that. Now, I got a couple questions that came through.
Yes.
All right. One is from Kevin here. He said he has a family history of cardiovascular. What can he do to mitigate this from him actually having it? Now, he mentions here that he doesn't think he has it now, but what can he do so he doesn't get it?
And again, you said Kevin has a family history of
Correct.
cardiovascular, right?
Yes.
Dave, it brings me back to a little meme, or I think the young ones call it a meme. I was looking, I show it to the kids every so often. It's unfortunate. There's a little kid sitting on a doctor's bench, and the doctor's talking to the kid, and the child looks like he's about 9, 10 years old. And he says, look, doc, what can I do? I have obesity that runs in my family. High blood pressure runs in my family. High cholesterol, heart disease runs in my family. What can I do? And the doctor takes a step back and he's looking at the child and he says, I figured it out. The problem is no one runs in your family. Okay. And that's a hard bullet to swallow. Okay. What that means is, hey, is it truly family history? Or is it more family tradition? Are you truly genetically predisposed? And there are some that are truly genetically predisposed to certain conditions that we'll get into over time with some of our webinars and discussions. But we're not genetically predisposed to everything that we decide to take on. Okay, you're right. Does everyone look at, there's certain things that run in my family that I just won't put out there, but there's certain things I said, oh, it won't run in me despite my family. So guess what? Start to do some of the things that are different. Okay, is everyone exercising and having these issues? Okay, is everyone watching what they put inside that body, that temple of the, you can't expect to get out more than what you're putting in. Okay, so you're looking at, so Kevin, who has a family history of cardiovascular disease, okay, I would encourage him to, you're right, be aware of those things that have run in a family bloodline. That is important, because I like to take that and work in prevention. Okay, you're right. You don't want to have a heart attack like your uncle did at 57 or 62. Okay, or your grandfather had a heart transplant in his 70s. Okay, I understand you want to try to prevent those things. What can you do now? That's why I love to encourage a person. I say, hey, are you ready? You're right. You don't want to take medicine for it. I don't want to prescribe it for you either. But guess what? I can't. I have the notion of, as a provider, you are trained to do no harm. Okay. You take a Hippocratic oath. First is to do no harm. And many, 90% of physicians have gone into it with the right notion to be able to take care of, but guess what? To do no harm. So I like to talk to a person. I was talking to someone earlier this week. He was on 4 different blood pressure medicines and has been for the last 20 years. And it's been told he has a family history of hypertension, but he comes in and unfortunately, when you look at him, his cholesterol is through the roof and he's almost 380. Okay. So how much of that hypertension is truly genetic related or versus habitual or lifestyle related? But before I can take him off 2 or 3 or even 1 of those, if his blood pressure is sitting at 180 over 110, which is very high already, okay, you got to encourage a person about a lifestyle. How can they start to take hold of ownership? You're right. I would like to see over the course of this year, we are safely able to reduce down to, guess what? When you did not need. So what does your life look like before you needed any news? Oh, I was in my 20s. I was going to the gym exercising. That was before kids. And I don't like to say wife, but that was before wife and kids and all these other things and a great job and, all these other things. But again, we had a podcast. Started to slow down. As we move up that ladder, we slowed down. So you're trying to get a person back to their pre-existing state before these things started to occur. Okay, that is where an element of something like RX Health and Fitness. Okay, I call that physician ownership. Okay, I wanted to see something, as Dave said, as we started the last 15 years that Dave and I have known each other, and you're talking and pondering about, hey, once you're out there, a way to really help engage and lead. Okay, this doctor with the team took out, as much as we could financially to just, guess what, provide a way. Now, when you have someone that says, look, I want to do better, I don't want this, okay, there's an opportunity. Now, who's going to take advantage of it? You have to put in the work, Dave.
Correct. And I think that's where the hardest part comes about when I see most individuals that they know.
Absolutely.
But it's the work part.
Yes.
And I talk about comfort. Comfort definitely kills most people. It kills greatness inside of us because we become too comfortable. And that's one of the things that people have to get out of that comfort zone again and get back. Why can't you feel as good as you did when you're 20? Everybody says, oh, I can't. It's age. It's age. That's the mindset that we can't have. And that's what proactive people try to do, is they get ahead of that because they don't want that.
Absolutely.
I got another question for you. It came through.
Yes.
Emily, she said over the last couple of years, her LDL cholesterol is going up. All right. So LDL cholesterol, anybody knows, that's typically what we call the bad cholesterol. Okay. So her LDL cholesterol has risen over the past 3 years. She doesn't want to go on any drugs.
Okay.
What can she do?
Okay.
To help bring the LDL down? Overall cholesterol is not bad, but it's the LDL that's up.
Question for you with Emily. Roughly what age is she maybe?
She is 30. She says she's in her 30s.
So Emily's young to me. Okay. And is she currently on any medicines?
No.
And she doesn't want to go on any medicines, right? So I just
that's
wanted to clarify that.
Correct.
That's important when you hear that as a provider, okay? So to me, Emily is very young, okay, and has not yet made it to what we would call midlife, okay, in terms of that life expectancy goal of 80 or 80 plus, okay? So she hasn't quite yet made it there. So from an age standpoint or from a provider standpoint, preventative care, excuse me, I see more than half of her life that she has not yet gotten to, and she wants to change things now. Now, when it comes to cholesterol, I know many have, started to look into that good cholesterol, bad cholesterol, and hey, anti-statin, meaning, anti-cholesterol lowering drug administration there. But what we now know, especially more about looking into the cholesterol, even the bad cholesterol, not all bad cholesterol is bad. And the person says, what do you mean by that? You look into more than just the LDLs. 10, 15 years ago, cholesterol or heart disease risk was based on a total cholesterol less than 200, okay? And then as they find out there's more that's just involved in the total cholesterol, you have things like a good cholesterol, a genetic determined HDL, okay? That's a cholesterol that is less inflaming to the body. An LDL cholesterol, the reason why they call it a bad cholesterol, okay, I educate a person, that's cholesterol that inflames your system, okay? The LDLs are known to inflame the system, okay? Meaning scarring your vessels, scarring your heart to want them to, guess what, heal with plaques. Not in all cases, but that's where they have under that umbrella of the LDLs. Triglycerides, okay, short-term fatty acids that can go one way or another, okay, but you want to try to reduce them, and they're more dietary related. They're less genetic related. You do have some that do have a what you call familiar hypertriglyceridemia, meaning they have a genetic high triglyceride, genetic basis, okay? Some also with the familiar hypercholesterolemia, okay? High LDL no matter what they do, okay? But I often like to educate a person before they go into how can I just lower my bad cholesterol, okay? Which can improve no matter if there's a genetic predisposition or not, with exercise and lifestyle changes, absolutely. But I like to educate them on what a bad cholesterol actually is. There's many ways to look into it further. Okay, if I really have a concern about her Emily's high LDLs in her age and where she is lifestyle, I'll look into that first in terms of I do get some extra metrics if I need to. An apoprotein B or lipoprotein A. Somebody said, what is that? That's looking at the LDL components there specifically to see out of that LDL range instead of just looking at the number, how much of that LDL is truly bad cholesterol. Okay, most physicians, cardiologists in the last 3 to 5 years have started to gather more of that information for their patients or for their people before they actually start to recommend, a statin or something of the sort or lifestyle change. I often educate a person there too. I'm not anti-cardiologist by any means, but a cardiologist is a heart specialist. Their goal is to never ever see you again for heart disease, okay, catheterizations, stroke. So they often provide an approach that is almost like, hey, I never want to see you again, okay? Preventative care approach is different. Same thing, I don't want you to have any heart issues down the road, but we're, as a preventative care specialist or person, you're looking at the whole person, their kidneys, okay, their lifestyle, their blood pressure, their sugars. You're not just looking at the heart. So you try to come up with a different approach. So I'm not anti-cardiologist, not by any means. They have a useful a utility, but I try to work with the person in terms of from a dietary standpoint. Exercise, we do know, no matter what, reduces a person's risk of cardiovascular disease by 50 to 80%. So despite where that LDL is, if a person is not actively engaging themselves, not physical activity, exercise, there's a big difference between exercise and physical activity. Walking up your steps, running your lawnmower once a week, okay, that's not exercise. That is physical activity. That's moving the body. Exercise is devoted physical activity, meaning you're exercising or keeping that heart rate. You're doing some continuous activity that's keeping your heart rate high enough for a long enough duration to create changes or adaptations in the body, whether muscular, okay, which is muscular strengthening, cardiovascular, that's not weightlifting, that is heart and vascular system building. So that's cardio. So when you hear someone saying cardio, that means you're moving, okay? But these are things that can lower that rate, Dave, by a significant percentage. And I like to encourage individuals to get moving and see how well they do.
Awesome. Honestly, that in depth of what you said of overall what Emily needs to look for, you know what I mean, is so key. It's not just one thing you've asked. It was she on medication, stuff like that. And what all our answers were like, what we said there. And I think that's important. You have to look at the whole picture, the holistic picture of everybody. We're winding down here, Coach.
Yes.
Or Dr. Joe here. One of the things that you mentioned right there was the cardiovascular. And one of the things that I've read, that I've been reading, is sprinting and long distance. Okay. Sprinting, in my opinion, is the greatest thing that a human being can do. Now, most people stop it when they stop playing a sport, whether it's 18, 19, 20 years old. So people stop. But here was a study that was just done. One sprint, okay, a day, 30-second all-out sprint, as fast as you can increase your HGH by almost 400%.
HGH, right?
Explain real quickly what HGH and why it's so important to the human being.
Talking about human
growth hormone.
Yes. So high intensity, or some you hear doing HIIT workouts or things of the sort. Okay, so you're doing something that is high intense in a short duration period of time. The body responds differently based on the different types of stresses. So, okay, a person who's a sprinter, okay, they're going from A to B in a short sprint period of time, giving themselves a break. The body will learn to adapt and cause different changes, okay? Somebody who's going from A to B over the course of 4 hours, but at a slower pace, okay? More endurance trained, okay? Those are different adaptations, okay? But when the body senses these high acuity, high intensity type stresses, okay? The body doesn't like it during that sprint. Blood pressure, heart rate, all of those things will go up during that sprint. Good, it does, because if it doesn't, you go down. That's called syncope, passing out, collapse, okay? So you do want that blood pressure and heart rate to increase during that period of time. But your body starts to catch on and release different growth factors to, guess what, be able to handle that type of activity. So you are causing your body to grow or adapt in a positive way, such that, guess what, you get that phone call about that grandchild that you've been waiting for, and you're super excited on the phone. And although your body doesn't know what's going on the inside, blood pressure, heart rate, catecholamines or adrenaline increases in your system, and the body on the inside is what is going on, but it's been prepared because it felt this same thing when you did a few of these high intensity sprints, okay, that the body can handle. It's not a stress to the body because your body becomes used to. The body is an adaptable machine. I love it. The body is an adaptable machine. What do you mean, Dr. Thomas or Dave? Okay, the body will adapt or will adjust to what we put it through safely and consistently. Okay, again, safely and consistently. So I'm not talking to someone here on the end of this webinar, go out and get your sneakers. Dr. Thomas and Dave said, head to the track and do that sprint that you haven't done in 50 years, okay? That won't end well, okay? So that's not what we're saying. But that mindset, absolutely. Can the body still learn to do your best sprint, even in your 70s? I agree. I worked with a lady 10 years ago. She was in her 80s. And over the course of a year, she was doing jumping jacks, okay, safely modified. She was able to go at a sprint pace of her own, okay? And her life, she was surprised at the adaptations that took place during the course of that year, okay? Absolutely. The body will adapt to what we do. If you sit on your rear, I mean, the body's going to get used to, guess what? Being comfortable sitting on your rear, okay? If you eat more than you burn off, the body is going to become adaptable, and that's called fat storage. It doesn't need to burn off because guess what? You're not burning, you're consuming more. Vice versa, if you flip the roles or flip the script on the body slowly and consistently over time, you'll be surprised the way the body adapts. I give a plain example. I love my job, Dave, and I'm very happy to educate and talk to people throughout the day. I may go through a good 12-hour day in the office and then another 3-4 hours every night. But in between there, guess what? I look at my lifestyle. I stand most of the time. I may only walk 10 feet back and forth. So during the course of the day, I'm helping others, but you know the person I didn't help? Myself, okay? So either at the start of that day or at the end of that day, I have a gym bag. I have it, and if I needed a little bit more rest that morning, that gym bag is in the car because guess what? Before I get home, I have to take care of myself. And that's in the midst of everything else that you have going on. But you take yourself as a priority. If you start to take yourself as a priority, the body will appreciate. You will be able to enjoy those things. You will be able to go and fly or go on vacation and not have to carry and lug 4 or 5 things with you just in case, okay? Or be afraid to travel because the last time you did, the back went out. and you didn't enjoy yourself, or you had a hospital stay during that time because you went and enjoyed and blood pressure went crazy. Okay. So,
Yep. And I think that's key. We're wrapping up here, doctor.
yeah.
When can people get more information? Where can they get it? RX Health and Fitness. And are you guys having an open house?
Excellent. Good question. To answer the second question, yes, our first open house here will be Friday, April 17th. Okay, and we'll get the times out. Also, the second part of that first open house, Saturday, April 18th. Okay, so coming up in a few weekends, we're here at the Central Hub, and I call it a Central Hub like that for a reason. I'll explain. Here at RX Health and Fitness, individuals will be able to do some walkthroughs. We've been blessed. We had about 30 plus walkthroughs in our first 3 weeks here, but it will be an open house where we have our whole team here, majority of answering those questions. Okay. The other part in terms of the RX Health and Fitness, what was the first question?
Yep. Where can they get information?
Where can they get information? Our website, www.rx-health.com, where you can go and you can take a look at everything that we have to offer. We even have remote plans, remote programs for those who live out of state and those who live hours away. So we're trying to make it where we can reach as many as possible and understanding the limitations.
Yeah. So guys, we're going to be doing these once a month, once every 2 months. We want different topics. We want to know what you guys want to hear. Okay. We want to fill you guys in. We'll do our research, all that kind of stuff. He's a genius here when it comes to all this kind of stuff. But we want to help you guys out. That's why we want all the stuff that we possibly can do. Okay. So guys, reach out to us. Come out to that open house. Okay. We want you to be here. We want you to be here. We want you to see what we have. And if you can't make those 2 days, April 17th and 18th, okay, then schedule a time to come in and just see the facility. You know what I mean? See what we have to offer. Get to know Noah, get to know Coach James, get to know Dr. Joe, myself, and everybody else here. We want to help people out. We want people to take back their lives. They have control of it. Absolutely. Not the disease or the sickness have control of you. We want you to have it. And that HGH that we were talking about just a little bit ago, which I think is so important. People don't know this, but HGH is one of the longevities. It helps with our longevity. If we can increase that and keep that up, guess what? Our longevity could be so much better.
So much better.
It drops so dramatically after we do those, like you said, the HIIT, the high intensity type things. It drops. And then people wonder why they have sickness and stuff like that. You need to raise it up. And like I said, the studies that I'm doing right now, and that's why I just brought it out with Dr. Joe here, is 30 seconds all out sprint. I'm talking about one, can raise your HGH 400%, like I said earlier, up to 90 to 120 minutes after you're done that run. That's amazing. Now, it doesn't stay elevated the whole time. So people think that, oh, it's elevated the whole time. No, it drops back down. But just that little bit. And like Dr. Joe said, you start slow. Maybe it's only a 5-second all out sprint.
Absolutely.
And then it's a 10. And then you gradually build. But that's why you come in here. We do an incredible assessment. Our honestly, assessment's one of the best I've ever seen. And I've been around and I've seen a lot of different ones, but it's in depth. So we know. And then what happens is if we need more, stuff on it, Dr. Joe's right there. That's why it's so key. This whole program is not just based on, well, it's just another exercise program. I go to a gym, whatever. No, right here, we get what he thinks we need for this patient, this client that we have, and then we take them through it, and then you're part of the family. So any last words you have that you want to fill in here before we finish up here in the next minute or two?
I thank those who were able to join this morning, and those, if you have not, send it to someone where they can watch the recording. Okay. Again, Dave as a master physiologist, okay, myself as a primary care, preventative care physician, and also a physiologist, want to see an engagement of individuals that are, ready to take hold or take ownership and work in that proactive. I can guarantee, I do it myself. Everything I recommend, I first apply to myself. The reason why I'm here at RX Health and Fitness is because 6 out of the 7 days I was already here, okay, and I saw the space and said, wow, how can I get my patients there moving? And where you had to, make sure you took certain days to focus on your physical health so you can be there for those individuals. But proactive versus reactive. And the goal, there's 2 different types of ages out there. And I want to leave this with you. 2 different types of ages, okay? A chronological age, we have no control over, okay? But yes, I want to maximize my chronological age. I don't want to leave here any earlier than the Lord would like me to leave here, okay? That's going to continue to increase. your quality age. Okay. I had someone look at me the other day and said, Doc, how old are you? I said, before I answer that, I have no offense. Guess, tell me. So you look like you're maybe in your late 20s, 30s. I said, thank you. Because you know what? That's the functional qualitative age they were looking at. They knew I was of age of some sort because of the years it takes, but my chronological age, I have no problem telling anyone I'm 42 years old, or I say 42 years young, okay? 42, my qualitative age, okay? That's taking ownership, okay? If a person's qualitative age or chronological age, okay, or they look their chronological age, I agree. We're still alive. The body is able to adapt. How can we reduce your qualitative age, okay, or get more out of that qualitative age as opposed to that chronological, okay? Most have no problem being their age if they feel much better.
Yep.
80-year-old doesn't have a problem being 80 if they feel like they're 60.
Yep.
Okay, they're still able to do the things they were able to do in their 50s or 60s or get back to that. Okay, so that's what I would like to leave you with. And again, thank you for joining us this morning, and reach out via the webinar there link. We also have the website where you can also reach out if there's ever questions, concerns, or anything you would like us to discuss during these series of webinars and even podcasts that we do.
Correct. And guys, hey, I greatly appreciate it as well. Listen, it's on Dr. Joe's Facebook, so we'll make sure that stays up there so you guys can get it. Also, if you have family members that want a copy of this, once it's done, I will get a copy and stuff like that, and I'll shoot it over to you. You just have to reach out to us, and we'll take care of that. But like I said, send us questions that you want to hear about, different things that maybe aren't mainstream, that aren't always, that you normally would hear, that you don't have time, that your doctor doesn't maybe take the amount of time that you need to listen to. This guy, like I said, I usually don't go to doctors. Most people know me, but I will go to this guy, and I will honestly go to bat for this guy because of how much time he takes and listens to his patients. And he takes my advice. I do a lot of my research, and he knows that. And he actually listens, and he takes it all in, and then we have a discussion. We don't argue about it. We just have a discussion about it, and he listens. And I think that's what we need to do, and that's what we want to get healthcare to be. That's why RX Health and Fitness is just another step of that. We want to listen to you. How can we help you get back to where you want to be if you're off course, or if you're not off course, how do you stay on course? So guys, thank you so much. We appreciate every single buddy who came in this morning. Like I said, we will be doing these at different times, different days, and we'll talk about all kind of different topics, but let's send it out, reach us out. Even if we're not on, reach out to us, and we'll talk about it during those podcasts and live webinars. All right, guys, thank you so much. You guys have a blessed weekend. Enjoy it. I know the season's coming up real soon, Easter, which is awesome. I know we always celebrate. We have a good time here. So, Amen. Guys, have a great one, man. Doctor, always a pleasure. You guys be blessed and take care.
Have a good day.